Hello, everybody, and welcome to Untether.tv. I'm your host, Rob Woodbridge. This is the place where we dive deep into understanding how mobile works, how mobile influences what we do. It's pervasive computing, this thing that we carry in our pocket, these things that are around us all the time, this connectivity. We look at the ways that it's enabling people to do their jobs better, ways enabling businesses to do work better, and us as consumers, how it helps us in finding product, services, anything you name it. This is what understand where mobile fits in. We know that it's going to be huge, that it is huge. And one of the things that I look to is an opportunity to speak to somebody who is using this technology as an enablement, as a problem solver, where you've got problem A and you've got a problem B and you've got to connect these things. And this is really where mobile fits in. And you know what? It's very interesting where we end up. We end up with physicians. We end up with physicians and clinicians and doctors and nurses who are trying to coordinate schedules, communicate with each other, and mobile fits and fills this void. So we're going to dive deep into this. And with me today is Terry Edwards. He's the CEO of a company called PerfectServe. Terry, thank you so much. I hope I didn't destroy what it is that you guys do right off the get-go.
No, that's a great opening. That's a great opening. Thank you.
Why don't you do a deeper dive, because this is a really interesting spot where you know, most of the time in the mobile space we're looking at big plays, big fixes for big problems that we don't even know that we have, or they're invented problems. But here you're looking at a problem that's existed since time, pretty much since there was a doctor and a physician, or a clinician and a nurse, and you're applying mobile to it. So tell us about PerfectServe, and then we're going to dive right into this. I'm really excited about this.
Sure. Well, first I'll just tell you who we are and what we do. So we work with health systems and clinics around the country. We work with them to help them simplify and really streamline their communications processes so that clinicians can better coordinate care. And we do that by making it easy for doctors and nurses to connect with each other at the right time and in the right way. And we're effective at it because we're able to allow the doctors to really filter and control the communications that are directed at them. And to get a sense of what this means, I need to probably just speak to the problem. And to give you some context, it would be typical that, let's say, a 500-bed hospital, the nurses and physicians in that hospital probably generate in the neighborhood of some 12 to 1,300 communications transactions per day. So these are calls and messages, texts and pages and things like that. Per day. To doctors in the course of providing care.
You think you've got it bad out there. Whoever you are listening to this, and this is important stuff, isn't it?
It says this
life
is
or death.
Very important stuff. Yeah, well, it's not all life or death, but some of it is. But it's certainly all timely. Wow. There are varying levels of urgency. Some critical, some not so critical, but all important. All important.
It's pretty incredible.
And so,
it's pretty incredible. Just amount of data that's being thrown at the doctors and clinicians and nurses, everyone. It's incredible, the amount of data.
Right. Well, and the challenge is that that hospital that I just described could very easily have 1,500 physicians on the medical staff. Now, these doctors will be working in smaller groups. So we might have 9 or 10 cardiologists over here. We'll have 2 primary care doctors here, 3 over there, 2 gastroenterologists, and so on and so forth. And each of these work groups has its own set of rules and processes for how they need to manage communications, and for under different situations. And these are if-then type rules. For example, if it's after 7 a.m. but before 4:30 p.m. on a weekday, then do this, except for if you're contacting me about a consult. But if it's after 7:30 and before, or 4:30 and before 7:30 in the morning, do something different. So there's these if-then process rules. There are call schedules, and there are call schedules for the group. There might be call schedules for a particular function, like whoever's handling new admissions versus inpatients, and then call schedules just for evening and weekend coverage. And then the last piece are the contact preferences, the personal contact preferences that the physicians have. They should be called and interrupted for certain things, a voice or a text message for other things, or a page for others. And so you have not only high volume, but you have high variability.
So who would have managed that before, or was it just? Was it the nurse on staff? Like who? How is that managed today without the use of these devices?
Well, it's two parts to that. First off, the devices add to the complexity.
I'm sure.
But how it's managed, it depends on the environment. We see environments in some communities where the nurses and the unit secretaries, those who are initiating the communications, have to know the rules. So they keep 3-ring binders of instructions and Rolodexes and with cards in them, and it's just hard to do that well, to keep all this information current. The other thing that we see are call centers and answering services, and they'll try and use software to manage the information, but every communication transaction that occurs requires that agent to have to filter through and decipher it, to interpret it. And that doesn't work very well. And who wants to talk to somebody when they're in a critical situation? You want to get right to the right person quickly. And so what PerfectServe is really all about doing is taking all those rules and all the information around the mobile devices and so on and so forth, and codifying that into software on our platform. And then if I'm a nurse on the floor or a physician, I can make a single call, I can go to a single website, I can launch a mobile app, one mobile app, tap on a doctor's name or say the doctor's name, then we'll run the correct algorithm to connect that nurse or that physician to the appropriate physician according to the recipient's instructions for that particular moment in time. So it's really all about enabling the rules to be followed. And that's the magic of what PerfectServe does.
It's what you've just described, I think, from a mapping standpoint, from a logistics standpoint, from a human error standpoint, is incredible when it comes to the intricacies of communication around something that's so very important. And as you said, obviously there's a scale, right, of how important these communications are. But when it's very important, you don't want to be hunting for stuff, do you?
No. We eliminate the hunting, and we're taking waste out of the process. So what happens is the rework, the repeat calls and pages and things that are attempted go way down. And then the communication cycle times are greatly reduced. So we had a study done a few years ago that compared a PerfectServe hospital to 3 hospitals that contact physicians using the status quo. And in the clinicians in the PerfectServe hospital were able to complete 10 times more communication transactions in 2 minutes or less than the worst performing non-PerfectServe hospital. 10
times. Yeah, like you're talking to a guy who, thankfully, knocking on wood here, you'll hear it. I haven't been in the hospital very much in my life, and neither as many of my family. So my experience has been through early days of St. Elsewhere and Chicago Hope, maybe not Chicago Hope, but these where everybody was on call and people are running ragged, and they're 18 or 24 or 36 hour shifts, and things start to fray around the edges when you start talking about people in the ER, emergency workers or doctors. But this obviously communication was such a key thing. They had everybody carry pagers. Doctors were one of the first professions to carry these things so that they could be on call. What has this done? What has PerfectServe done to enable? It almost sounds like a little bit more freedom in the doctors. They're not being dictated to about how they're communicated to. It's the other way around. What has it done for their lives?
Well, it's a platform like PerfectServe, which can enable their processes to be easily followed, coupled to new mobile smartphone devices, are really giving physicians more freedom and more capability, as well as reducing the stuff that they have to carry around. If you've talked to anyone within healthcare, you've probably heard the stories about, open up your lab coat and you open it up and they look like a Bandito or something like that.
Yeah.
got two pagers here. I've got my hospital assigned smartphone. I've got my personal smartphone, and just all this stuff. So we're able to allow the clinicians to really simplify and go down to one device, but do so in a way that still to build high reliability into the communication process, because these devices will fail. There are times when you're going to drop calls, you're going to have a delayed message, and so you have to know what are we going to do when it happens. So
how long has PerfectServe been around for? How long have you guys been doing this?
Well, we started in the late 90s, and we began by focusing on the physician practice sector. And in 2005, we identified the hospital market opportunity and really began focusing all of our energies there to develop that market, because there was just tremendous need there.
So, I mean, obviously, the landscape has changed quite dramatically, I would say, since you guys started. When you start to look at the accelerant for you guys, there's got to be a growth spot for you. There's one thing to automate that process, but obviously, when with the proliferation of these smartphones and even tablet technology these days, with patient records coming on board, University of Ottawa, a hospital here in Ottawa, was one of the very first hospitals in Canada to have patient records and diagnoses come up on iPads, and an Ottawa company built this for them as well. So we're starting to move into that space. So obviously, when you kind of go a little bit forward out, how important a role are these devices going to continue to play and grow in importance for doctors and hospitals?
Well, the adoption is going to continue. We've seen just tremendous adoption of smartphone devices with physicians over the last couple of years, and we're investing heavily in our mobile app development for physician end users. The inside walls of the hospital, it's still a tough environment, though. The outside of like specific departments, nurses are still kind of subjected to these industrial, kind of 1985 type wireless phones, and some of that has to do with the fact that they're just very rough. A device, for example, is a beautiful device, but I don't think it takes too kindly to having blood being dropped on the concrete floor and those types of things. So there are different challenges, but I do think we're going to see smart devices grow inside the four walls of a hospital as they continue to grow outside, driven by the doctors. But the other thing is just the power. I mean, we've been just in a communications mode, but the power of having a computer and a phone and the internet all there in one mobile device is tremendous. So there's just great utility.
What about things like you can see the doctors adopting these technologies very clearly. Nurses, I mean, everybody's carrying one of these now, whether it's a BlackBerry, an iPhone, an Android device. People are carrying these things. We just know that. But you guys, as a company, going in to try to sell this service to hospitals, are you finding that there's resistance there, or are they looking for ways? I don't think that hospitals in the States and Canada are looking for ways to spend more money. Not at all. But are they must be, were they hesitant to start to talk to you about this when you started to approach them about this kind of methodology around mobile?
Well, certainly they were early on, because the market for our services didn't exist. And we're seeing a change in that now. And it's I think the growth in consumer text messaging has been a new recent dynamic. It's added to the complexity of an already complex environment, and then B, consumer applications of SMS text messaging don't meet HIPAA compliance standards, and really create risk for the individual clinicians as well as the organizations. So that's really forcing a situation where hospital CIOs have to now begin looking for a solution to the problem. But when they start to shine a light on it, it's like, oh my gosh, this is more than just text messaging. We really need more of a comprehensive, secure communication strategy, and that's something that PerfectServe is able to help them.
Well, so how do you do that? You know, it's funny because you know, when we use Skype, that's what we're using right now. Sometimes it's good, sometimes it's bad. We might have a few little audio issues here. We're fading in and out, but they say very clearly that this is not 911 compliant. This is not a replacement for your home phone. You know, don't rely on this technology for communicating. And what you're saying basically is, listen, SMS and standard messaging services are not HIPAA compliant in order to be able to. There's no guarantee that the text arrives or that it can be relied upon. So how do you guys come around and create the environment that allows people to feel comfortable that every message that they send out is actually going to arrive where it should arrive and when it should be arriving?
Well, we developed our own messaging platform and actually put that into production the first part of this year when we're building on it. But that allowed us to really isolate, really block off what can get into the platform and where it can go. So we control what comes in, we control how it flows inside the network, and nothing can leave the network. So that gives us the security that we need. And then by having control, we're able to monitor the status of these various messages, and then we can escalate notification on them if certain messages aren't retrieved or acted on within certain periods of time.
See, that's really interesting, right? Is that when you can put almost like an assistant on it digitally that allows you to repeat the same request until you get a response. It's like an alarm system, obviously, but you know, I'm going to bring it back to the product here for a second. So you built this internal communications tool, right, which follows rules, and it's very, very straightforward on the rules that it follows. It's much easier probably to program than it is to keep track of for one human to keep track of all of these rules in a hospital. But when you guys were building this, you know, did you focus on, you know, the three features or the one feature that really married well, that there was a big challenge with, you know, that could be addressed, and you satisfied that issue? Or did you have a rollout plan? Was this a complex rollout plan, or was it just like the top 1, 2, 3 features that there was already a pain?
I'll tell you that the development of the platform has been ongoing, and it's really been driven by, I mean, it's almost been like a continuous R&D effort. And it's been driven by thousands of physicians that we have worked with over the years. I mean, we've got almost 25,000 physicians on PerfectServe right now. There's 150,000 rule sets.
Wow.
100,000 call schedules and 50,000 contact preferences on the platform today. But to answer your question about how this was developed, I'll take you back to how we started the company. I was involved in one of the early pioneering companies in the voice messaging space back in the 1990s, and actually moved to Knoxville, Tennessee, where we're based right now. And once we got settled, my wife, who's a registered nurse, went to work for a solo practice pediatrician, and she started taking call for this doctor on the weekends. And I would observe how the patients would call the answering service. They would sit on hold, leave a message. The answering service would page my wife. She would call back in. She would sit on hold, get the message secondhand from someone else, then call the patient back. And, you know, by now it could have been 15 or 20 minutes, so they could have received another call. The line's busy. And you just see all these steps and all this waste. So I went out and I just started talking to doctors and practice administrators. And what I found is there's this huge volume of complex communication that pours into these physician offices, and they don't have the technology and can't afford it to really address their needs. So we just started working with doctors, and it just began to grow. And after a couple of years and really prototyping the technology, we raised capital and then really began to grow the business more aggressively. But it's been just a continual effort working with physicians, working with different specialties, and all the knowledge that we gain goes back into the platform.
And I think that that's the right way to do it. You know, would you, if I characterized it as you're filling holes as you find them, is that the way that you would characterize what you're doing?
Yeah, I would say that's a good way to characterize it.
And that's what I love about this, is that, you know, it's not coming in with a solution. And I know that the late 90s, early 2000, well, in the formative years of this, you could have made that decision to go in there with here's our solution right here. We're going to put it in, and like an SAP implementation, where all of a sudden it's 5 years of development and many millions of dollars and headaches and retraining and retooling. But what you're doing is it's more of a nuance, where you're saying, well, you know, we can help you over here by doing this, and we can help you over here by doing this, without changing your behavior, your human behavior about doing this. We're just putting rules in place that alleviate the pressure from you.
Well, exactly. The problem that we were solving in the earliest days was the human error. That's what drove the doctors to change. And so we're like, well, we'll use software to eliminate the need for anybody to interpret your rules. We'll make it easy for them to be followed, and the errors will go away. And that's exactly what has been carried into the hospital environment. But there's just a higher volume of communications, and some of it is more time sensitive and more critical, because there you're really looking at communications are central. The communication processes are central to the care delivery processes. So bad communications can create bad care outcomes.
Absolutely. I mean, I don't know anywhere where it's more critical to be able to communicate effectively. And I mean, would you say that, or what would you say that the implementation of technology, moving it into the mobile realm, has allowed doctors to communicate the right things and kind of eliminates the stuff, like the administrative stuff behind the scenes?
I think so. I think doctors, and many of them would tell you that they still are not talking to each other as often as they should, and we're trying to make it easier, and they're not doing it because it's hard for them to do it. In hospitals that don't have PerfectServe, for example. But I think that in many cases they want to talk to each other more but can't because of the complexities.
Well, you know, it's a I always wonder about these things, because you know, it almost seems like the doctors do work in silos, but you know, you've got doctors. If I think of it like a command center with doctors in the middle of it, especially in a hospital, as they meet in the middle, which is somebody who holds the information, somebody who is directing them to where to go, to what patients to go and address, and then they spread out. And then somehow that information ends up back into a spot, into a form that is processed and gone through administration, and then they're back out into the wild again, talking with patients and servicing patients. And it always strikes me that when they get together, it's about information exchange and consultation and discussion around patients, or help. Hopefully, this is in my mind the way that I see it working. So when you start to look at how you guys are evolving PerfectServe, do you kind of do you start to think about that, about the best ways to share best practices out to doctors? Are they interested in that kind of stuff?
Oh yeah, I mean, as we have gained an enormous amount of knowledge about how to best apply our platform for given clinical situations. So if you're a group of pediatricians, then these are things that you would want to consider. If you're cardiologists, these are other things you would want to consider. But the other thing is that we also have to look at the flow of communications, not just inside the hospital, but outside the hospital as well, especially as we're moving to an accountable care environment under health reform. In that environment, hospitals and really health systems become responsible for the care of a patient across the entire continuum. So that's a pre-acute, acute, as well as a post-acute care environment. So the need to enable effective communication, for example, as a patient transitions from the hospital back to, say, a skilled nursing facility and eventually to the home becomes really key to avoiding them coming back to the hospital for some unnecessary need.
Well, how do you do that? I mean, your focus is inside the hospital, is it?
Well, when we went into the hospital market, we looked at the communications that the hospital generated to the physicians, and those physicians are all mobile. So whether they be mobile inside the hospital or they're mobile outside the hospital. Now, since we've been in this market, there has been an increase in hospital-based medicine, but that's primary care. Now, outside of anesthesiology, and there are a few other areas, intensivists, but the big surge has been with hospitalists. So the primary care physician isn't coming into the hospital, and so we have this divide. Well, the primary care physician may need to talk to a hospitalist who's going to care for his or her patient before the acute setting, and then the hospitalist may need to talk to the primary care doctor upon discharge. And so we're enabling that. We've always connected the doctors wherever they're at, but there's an increased emphasis on the post-acute care environment. It will not de-emphasize the hospital environment, but we'll need to put as much emphasis in a post-acute care environment as we are in the acute. There are a number of new apps, quite a few that we're seeing. There's really some fascinating things happening with mobile apps that consumers might be using. There are a lot that are more fitness oriented, but then I think the opportunities for home-based monitoring of patients is significant, and we're beginning to see tests in certain areas, especially for chronic patients. But then the question is, all right, where does this data go? Because the reason why doctors can be difficult to connect with is they have to put up barriers to defend themselves so they can get their work done. So we're putting filters that say these things get through and those things actually go, left, while these things should go right. So when you begin to look at this home care environment and there's this data that you're creating, then the next question is, well, what do I do with it? Because the typical consumer product response is, we'll send it to the doctor. Well, what's he going to do with it? You've got to make sure it has to follow some kind of a process. So, and what we're seeing here is the rise of a new role in healthcare, and that is the care coordinator, who's like a project manager for your care. And they really will be the one who is at the center of making sure you're guided to the right resources. And that's an emerging market right now, and health systems are trying to figure that out, and we're working with our clients to help them do that.
We're speaking with Terry Edwards, who is the CEO of PerfectServe. What about the implications of this? This is a new world. I mean, I've been alive long enough to go through that. The challenge of digitizing medical records, and we're still not there. But this mobile space really does open up opportunities for for more challenges around privacy issues and collection of data and such. I mean, are we ready for this yet, or are we still many years away from this really kind of becoming a seamless process where you've got the perfect vision of diagnoses based on a chart that you've got access to anywhere you are, and you've got a patient who understands what's happening with their body and with their health, and it's kind of this seamless, perfect flowing waltz that is happening in the medical field. Are we there yet, or are we a way away from that?
I think we're a ways away. We've got a lot of systems in healthcare that are closed and they're proprietary and they don't talk with each other. There's a lot of projects around health information exchanges, but the business models, not all, but many of them appear to be flawed. So I think we have a long ways to go. There are some systems that are just totally integrated on a regional basis. Like Mayo or Geisinger, and they can do things that the average community hospital can't do. But we're still a ways away. So there's a lot of innovation there.
It strikes me. I mean, so is this an opportunity, or is this just because it strikes me? I'm an entrepreneur at heart, and I look at this and I think that's a mountain that is too high for me to scale. It's a wall that I can never get over. It's administration, it's bureaucracy, it's challenges around privacy. I mean, you're stepping on landmines everywhere if you want to get into this business that you guys are in. That's my impression of it. Am I off on there? And why would you guys get into this business?
Well,
sorry for putting it. It's a good question, right? Because there are many challenges.
Yeah, there are enormous challenges, but we were up to the challenge, I think, early on, and we began to have success. We're now at a point where we have some size and some scale. We still have a long way to go, and we have tremendous growth ahead of us. But we're here now, and we have the relationships with the clients, and the sales processes are very, very long and arduous. But once the relationships are in place and you're really a trusted partner with your clients, then you're there to collaborate with them. And I look at the issues that we're facing as a nation with healthcare and costs, and we have got to improve the way care is delivered in this country today. And we're doing our part. And so that's the bigger reason why I'm here and I'm involved in it. And I get a lot of satisfaction, as do our people.
Well, and it's something that I love to see is moving this technology forward. Sometimes I think we should just light a match under it all, and start where we should start, right? It's the idealistic approach, which is, listen, some things just can't continue on a linear track, because that linear track is just going to go off a cliff. Right. So when you look at opportunities out there, is there a divide here? I mean, really, and be honest here, when you look at the mobile landscape and inside of hospitals, inside of healthcare in general, is that really a growth opportunity, or is it about new innovation in mobile, or is it about just enabling existing technologies in a mobile sphere and then kind of making your way doing it that way? Where are the opportunities?
Oh, I think it's some of both. I think we don't really know what we have yet. When we look at these devices, for example, and I just think about, as I'm thinking a lot about trying to get smartphones in the hands of nurses. How can we do that? How can we get them better connected with the doctors? And there's, I'm looking at it from the area, the problems that we need to try and solve. Simple things that you would think are simple, but they're not. Like how to get the communication of a critical result from a lab system to the right nurse who's caring for patient X right now, as well as to that doctor, and making sure the doctor is not interrupted with things that he or she shouldn't know about. That's a problem that people have been trying to solve for several years. And I'm seeing, promise in platforms like we've built, as well as mobile devices, is really helping us bridge that divide. And I think, too, as I talked about this care coordinator role and that rise, and we begin to look at applications for patient monitoring, that's a whole nother area of innovation as well, and an area where we see a tremendous amount of opportunity.
Yeah, but it's interesting because same things that I look at maybe with hospitals and administration is the same thing as governments. Is that I think that there's a lot of patchwork to make things work effectively, and there's a process by which it has worked effectively as it can under the circumstances, and so I wonder if the enabling factor of mobile and the mobile technology allows us to fix challenges that are happening right now that in a faster way, so that it might take a long time to implement a new process inside of a hospital, but take it out and put it on a mobile device, it might leapfrog some of those challenges. It might be a technology that is enabling as opposed to something that is that might take many years to implement. Is that view, am I off on that, or is that something that you guys look at it as well?
I think we look at it. I think we're when we approach problems with our clients, we always want to check our baggage at the door, and that can be a challenge in health. And so as you look at these new technologies, you really have to take a fresh approach. And one of the things that we do oftentimes, we're looking at these new problems. It's all right. Forget you are at PerfectServe. Forget that you know anything about healthcare. If you were to come in and solve this problem today as a startup company, how would you do it? What would you do? And it allows you to really clear your mind and sort of start with a clean whiteboard. And what you end up finding as you work through some of these exercises is, well, that sounds good, but there's this, and then but there's that, and then but there's this, and we designed it this way because we had to address that. And those are the things that can pull you back. But those are the challenges. But I think the real drivers here with industry, really, in the United States, hospitals are going to have to learn to survive on Medicare margins. And that means they are going to have to improve their productivity and efficiency significantly. And that comes down to process improvement in a variety of areas.
So, I mean, that's where the opportunity lies, isn't it? Right.
And so it's what technologies can we apply with a positive return that will help us improve throughput, for example, and get more capacity so we don't have to build another building. What technologies and process changes can we apply to make sure certain critical information is getting where it needs to be in a more timely manner? And there is no shortage of opportunities to improve. No shortage in the industry right now.
So I completely agree. I think about this all the time, is that when what once was a problem that was unsolvable, now with technology as an enabler, I mean, it's never the thing that you bring in. You never bring in a technology and say, where can we make it fit? You have a problem, and then you go and find a technology that alleviates, circumvents, eradicates that problem. And I think that that's one of the coolest things around what this industry brings with it is you've got the computing power of one of the most powerful computers 15 years ago in your pocket now, and how can you enable that to help in the process, like you guys are doing at PerfectServe, to help doctors and nurses and pharmacists and everybody else do their job effectively, so that they can actually, as you said, do things faster with fewer mistakes. Humans are humans, and we're fallible, right? And so is technology, but not as much. What about, just one more question around this, and this could be a long one, but what about hurdles here? Like when we start, there's massive opportunity. We've identified one hurdle as bureaucracy, as this is the way that they've done it for so long. But when you start to talk about, are there clear hurdles around mobile and the future of medicine, and how this can help enable a patient get better? I think, which is ultimately what the goal is.
I think there are hurdles there in a couple of areas. One, on one hand, more transparency of information and access to data, and the desire to exchange data, and the mandates even driven by the government to exchange data to qualify for meaningful use stimulus dollars. And on the other hand, the penalties for security breaches and violations. And these things are oftentimes just fighting with each other, neck and neck, and it's getting worse. It's not getting better. And so you've got to be innovating around how do we solve these problems. And then I think the other hurdles are we talked about it earlier, but it's the nature of healthcare and very large institutions, and the sales cycles are very, very long. And for new companies entering the space that do not know or understand the healthcare market, they can burn through dollars very, very quickly. They can really get crosswise with their investors and their boards, just due to the realities of this market. So you have to know what you're getting into when you go into selling services and technologies into healthcare, because
it's a big challenge. I mean, are you guys funded revenue-wise, investors? How have you guys been able to survive?
We've been able to survive because we have been able to manage expectations with the investment community, and we have continued to raise money over the years very successfully. We've had our share of down rounds, but we've had up rounds, and we've done well. And I'm still here, and key members of my management team are still here. So we've been able to get through it. But I can tell you that my skin is a lot thicker today than it was 10 years ago.
No doubt, no doubt. I mean, think about what you've seen in 10 years as the technology has advanced, and not only diagnoses and inside of hospitals, right? I mean, I think about my lifetime, all 42 years of it, and I think what has happened in science and medicine in 42 years is pretty amazing. And now it's about enabling, as many patients as possible. We have a certain expectation as humans about the care that we should be provided to, and humans make mistakes. And I think what's really interesting is that if we can enable some kind of digital brain, whether it's a smartphone tied into your technology, to reduce those mistakes through processes, I think that you're doing your part in order to be able to enable longer lifelines for humans. Very clinical way of putting it. Now, when you project, you go a little bit out into the future. I mean, in your industry, what is it? Is there anything out there that is getting you excited about around technology that you're using, whether it be mobile or anything else? What is it that you're looking at thinking, oh, I can't wait till this is brought in, that we can use this, that we can do this? What are you seeing out there?
I think the advances of the mobile operating systems, I mean, to me, this is just, it's kind of wild to look at what's happening. And these are things, directly related to our business, as well as things that are not. I'm amazed at what I think we're going to be able to do with these devices in our hands, 5 years from now. We're doing things now that you wouldn't have even imagined. They've only been out for, what's the iPhone been out? 4 years?
Just 5 years, yeah.
And you can't imagine life without it today. You just can't imagine what it was like. So give it another 5 years, and then we'll see. But just very, very about what the development that's going on, and the rapid pace of continued innovation of these OSs, as well as the hardware. I mean, every time Apple comes out with a new OS, it's like it's a game changer again. And
it is pretty amazing, the advances that we've had there. And at some point, I wonder if the technology that we've got here in these devices that we carry, merges with here, and all of a sudden we've got our onboard diagnostics and technology embedded that actually is predictive technology, or tells you, like we've heard these everywhere, where it says people say the technology is going to come through mobile devices and sensors that say, okay, get up and call 911 right now because you're 90 seconds away from having a heart attack. That kind of predictive technology. Do you think that comes down the road?
That is near term. That is nearly here. There's been an explosion in sensor technology, and Qualcomm has invested heavily in its own network for the broadcasting of I believe, don't quote me on this, but I believe it's wireless monitoring data. And so there will be those types of applications are near term.
Does that help or hinder you guys? That must help you guys in bringing that kind of communication into kind of a real-time environment for doctors to know what is going on.
Gets to the question I said earlier, and that is, all right, so now you start getting all this data from all these patients. What do you do with it? And where does it go? How does it filter? How is it acted upon? And that's going to take process, that's going to take rules, that's going to take communications. And so that's why I say that's a new area, that's a new frontier. And that's not inside the hospital, that's outside the hospital. But that health system, patient in his or her home, is still responsible for the cost of care of that patient, and that's where that overlap and that connection occurs. So that's the
Amazing, and I think that we're on the forefront, as you said so well, Terry, that we don't know what these devices are capable of yet. We don't know what we have in terms of an ability yet, and I think that we're going to start to see that evolve as we go. And you've seen it over 10 years, and I can't imagine what the next 5 or next 10 years brings for this. Is that it's pretty amazing. I'm very excited about this. So I really appreciate you doing this, taking some time out of your day, and helping us try to figure out where the opportunities are, where the challenges are, and what you guys are doing at PerfectServe in order to be able to enable better communication between doctors and physicians, clinicians, nurses, pharmacists, everybody in this space. It's pretty cool. It's pretty amazing.
Cool. Thank you. Thank you for your interest in what we're doing, Rob, and I hope to talk to you again sometime in the future.
We've been speaking with Terry Edwards, who's the CEO of PerfectServe. I'm going to pull up their website right now. Just go to PerfectServe.com, and they have a PerfectServe clinician. You can download an app. There's a great video up there which will show you how it can be used. But just go to PerfectServe.com and you'll find all that information. Terry, thank you so much for being a part of Untether.tv. I really appreciate your time.
Thank you.
For those of you who are out there still watching, listening, wherever you are, whatever you are doing, thank you for bringing this into your day. It means a ton. If you've got any comments, feedback, suggestions, reach out at untether@gmail.com. We will see you next time for another episode of Untether.tv.